Well, welcome and thanks for joining us again. It's Thursday the 20th of February in the year 2020. And the main news today is, well, there's several parts of main news today, but one of the things is some reduction in cases in China, but an increase in cases outside of China. So we see South Korea, for example, at 104, Japan at 94, Singapore at 84, Hong Kong at 67. Quite a few cases in Thailand, and the list goes on to 29 countries. So let's just have a quick review of that news there. Good evening. Right. So SARS coronavirus 2 is the virus, COVID-19 is the disease. Thursday the 20th of February. Now, current confirmed cases and accumulated confirmed cases. Now, some of you weren't too sure about this. Now, in epidemiology, we talk about incidence and prevalence. Now, incidence is the number of new cases, normally in a particular period of time. So the number of new cases per day, per hour, per year, whatever the disease is. It's the number of new cases. Whereas prevalence is the overall number of cases at any one time. That is prevalence. So acute diseases tend to have a high incidence and a lower prevalence. Whereas chronic diseases like multiple sclerosis will have a lower incidence, there's less new cases every year, but they'll have a higher overall prevalence as there's overall more cases. So this is kind of an accumulated prevalence, really. It's the total number of cases there's ever been in the outbreak. It's not quite the same as prevalence. Well, it is if you include recovered patients in it. So incidence is the new cases, but this is the people that are actually suffering at the moment, current confirmed cases. So these have it just now. And this is the accumulated total here. Now, suspected cases is down. In fact, most of these are in China, so these numbers are down. The number of new cases in China being officially reported are down, which is good news. We'll look at reasons for that in a minute. Now, everyone knows that these numbers are underestimates. There's no doubt about that. I'm not talking about conspiracy theories here. We know these are underestimates. Severe cases continues to concern me because we simply haven't got the medical facilities to care for a lot all at one time. Confirmed deaths. Recovered cases continues to rise, which is excellent. Countries affected 29. And the basic reproductive rate is still around about 2.6 as far as we can tell. Now I want to look at some news next and try and explain some of these figures. So moving on to these news items. Now the Chinese authorities, the Chinese Health Service and Family Planning Authority, have given out some new guidelines on the management of COVID-19. And at the end of that report, they said it was airborne, spread by aerosol. So this is now recognised by the Chinese authorities that this is an airborne infection. Now, we've always known that it was droplet, but now we're saying it's airborne as well. Now, if you want to watch the last video, that covers that in detail. But just to give you a very quick resume, droplet means it's close contact. So here you're breathing out heavy water droplets and they're going down to the ground. They can be picked up off surfaces, but they can go straight to the mucous membrane, the nose, the eyes, the mouth of the person that you're infecting, normally within about 6 feet, 2 meters. So normally a meter or two, that's droplet infection. Whereas aerosol infection is over time and distance and even through gaps in walls. Person doesn't even need to be in the same room. So the virus will survive in the air for longer and it can spread over a distance moving through air currents. And the implications for the transmissibility of the virus are completely obvious from this. This makes it way more transmissible. Now, I'd pretty well worked this out. Most people had worked this out, as we'll see in a minute from the Diamond Princess, but that's now official. And the other thing that they've come out with, the Chinese authorities, shared sewage systems. Now, this came about from a case in Hong Kong in a block of flats, where one person on one layer had it, and another person quite a few floors down caught the COVID-19 virus as well. And what the authorities in Hong Kong have worked out is that there was some regurgitation in the sewage. So someone in one flat would defecate in their toilet, as you would. And then they flushed the toilet, but that went into a shared sewage system. And some of that regurgitated into someone else's toilet, where viral particles from their feces aerosolized and were inhaled by other people, or landed on surfaces in other people's bathrooms, which they then touched and came into contact with their mucous membranes. So now no question that this is excreted in the stools and spread in sewage if there's any cross-contamination or contamination of surface. Meticulous hygiene after using the toilet is clearly essential here. Before the toilet is flushed, the lid on the bowl should be put down so that the aerosolization from the flushing effect doesn't get into the air, doesn't get onto surfaces. So we now know that it's spread in shared sewage systems. In other words, essentially, this is a fecal to mucous membrane transmission. Of course, we've always known about fecal oral transmission from the feces, one person's contaminated feces into the mouth of an uncontaminated person who becomes infected. But this includes aerosolization, so viruses from the feces of one person gets into the mouth, the nose or the eyes of an uninfected person. 5 cases in Iran, sadly, 9 cases in United Arab Emirates. Now, the Diamond Princess experiment. On Tuesday, there was more new cases, 621. Another 13 cases on Wednesday, 634. So 17% of the people on that ship have been infected with COVID-19. The only question is, when were they infected? Were they all infected before it went into quarantine? Well, I think we know the answer to that. That's quite an easy question now. My belief is that the majority of these were infected during the quarantine period. Now, the information I don't have on the Diamond Princess is how many severe cases. I'd really like to know that. And it's not been published as far as I can see. No, the number of severe cases. I think we know that 2 Japanese passengers have died who were on it. So they were clearly, obviously, severe. But how many others are needing oxygen support? That would interest me. If we could know how many, because this is a large sample, if we could know how many of these needed oxygen support, that would inform health planners around the world how much oxygen we need to get ready for the people that are going to get sick in my hospital. That would be very helpful. How many of these needed ventilatory support? How many of these needed antibiotics for secondary infection? Really, all this information is critical and should be made public as soon as possible, please, Japanese authorities. Please let us know all that information. Now, the people that were tested negative on this ship got off. They went onto buses with people with full kit on, all the full protective suits on, the masks, the goggles, the everything. Then they were dropped off in the middle of Yokohama, and they got on buses and trains. There you go, that's what happened. And they've gone back to 50, or they live in 50 different countries. And they're not going to walk back from Japan, they're going to fly. Now, you don't need me to spell this out. Now, they have tested negative, but we know that people have tested negative have subsequently become positive. We know that people can be asymptomatic, subsequently test positive, and subsequently become symptomatic. But this is what they are being allowed to do. Let's just say I don't understand the Japanese authorities in their whole management of this debacle, catastrophe. What do you want to call it? Let's say there's something I don't understand here. Now, yesterday I was wondering whether the crew were unskilled. Now, there was a Japanese epidemiologist went on board the boat, and he was horrified that the crew were sometimes taking precautions and sometimes weren't. So sometimes they were protecting themselves and other times they weren't, which he said is the worst possible situation. Now, to be fair, these are people largely involved in catering and sailing ships. You wouldn't expect them to be skilled in infection control. So that's been part of the problem. But also now it looks fairly definite that there's been airborne spread within the ship, accounting for numbers of this and percentages like this of the total number of the 3,700 people on board, or whatever it was. 17% are now infected. So, interesting little experiment. We can conclude we need skilled people to prevent the infection. We conclude that we need to bear in mind the possibility of airborne spread. So, for example, apparently my government has block booked the Holiday Inn, I think it is, at Heathrow Airport. So if you put a lot of people that are all positive together, again with some that probably aren't, then, you know, will that hotel turn into another Diamond Princess? I think that possibility has to be considered. What should have happened, of course, was that these people should have been isolated on the Japanese mainland separately. And the Japanese, I think it was a Japanese health minister, was on television today saying they didn't have the accommodation for these people. So they couldn't isolate 3,700 people in the nation of Japan. Well, that's what he said. Now, the WHO, World Health Organization, movement restrictions in China have delayed spread by 2 to 3 weeks. So the Chinese have done a phenomenal job. Phenomenal. Beijing is almost shut down if you look at the news reports. People are self-isolating, staying at home. People returning to Beijing after have a compulsory 14-week self-quarantine under threat of punishment if they don't, and rightly so, I would think, because this is people's lives we're talking about. So hundreds of millions of people basically have got their lives severely restricted at the moment. And the World Health Organization say that's bought us 2 to 3 weeks. So let's get some more data out. Let's see what's happened to these people. Let's see how many are severe ones, and help us to get ready for this. We've got a few weeks. Vietnam, apparently, I've got emails from some people that are teaching English in Vietnam. And people are emailing me from all around, which is fascinating. I do apologise for not answering them all. There's just been so many comments and so many emails. I'm answering the ones I can, but there's only so much time in the day. But apparently all the schools in Vietnam are closed, like all of them, until the end of March. So quite significant closure, really. So that's what's happening. Reduced spread in China due to, I guess in the West we'd call it draconian measures to limit the spread. But it's buying the rest of us time. But we are seeing increasing spread in other countries of the world, as we would expect in the early stages of the pandemic. Still no official reported cases in Africa apart from that one in Egypt. I do hope that's the case. I suspect it isn't. In fact, that's a paper we're going to look at tomorrow, possible spread in poorer parts of the world. Yeah, okay, I'll tell you. Just one piece of slightly personal information. I actually got some feedback from the director of the World Health Organization. What's his name? Dr. Tavid or something. And he actually said he liked the video, so that was very nice to hear. Yeah. Anyway, right now. Against my better judgment, I've been talked into doing a live thingy, so I'll put a post up for that as soon as I work out how to do it. Sorry about Australia. We'll get it right for Australia next time.